All right, guys, we're in the back of Ambulance 909. I just wanted to give you a rundown on our PPE situation. Some guys were confused. So let's start at the back, the top corner right here. We have regular surgical masks. There's 2 boxes of surgical masks there. So that's like 100 surgical masks. We should be pretty good. Up in the top corner, there's some PPE kits, as well as some just surgical gowns. There's at least 20 surgical gowns right there. If we go a little bit further in, we have our N95 masks in that box there, and 4 sets of actual goggles. They're pretty good because they seal up really well. Next, if we turn around on this side, there are 4 Tyvek suits, 2 size XL and 2 2XL suits. These would be used if you had like a cardiac arrest or something similar where you were really worried. Somewhere I might want to use those now would be Roast Packing, if you get an ambulance call there. Behind those Tyvek suits are safety glasses. So if you don't want to wear goggles, you could also try safety glasses. Remember, down here we have our hand sanitizer that we talked about that you guys can use to spray down gloves, and then you have your bottle of spray Cavicide cleaner. In here we have our face shields. These are individual disposable face shields. You put them on your face and they will cover you. When you're done using them, throw them away. There's a whole bunch of them in there. Down here we have that orange bag. That's a PPE bag. That bag should remain sealed, but for some reason, if all the other supplies were exhausted, you can go into that PPE bag and get your PPE. Also, down here, which can be reached from the outside compartment as well, are a whole bunch of 2XL and XL Tyvek suits. Now, if we come around to the outside of the vehicle, in this compartment over here on the side compartment, there's 2 extra spray bottles. One has DZ7 in it and one has bleach and water for cleaning when you're at the hospital. And lastly, in the front cab are some regular surgical masks, as well as the homemade masks that Sue made for us. One thing I want to point out too is, once you use an N95 mask like this guy here, make sure you put it, if it's not soiled, put it into a brown paper bag. Please put your name on the bag, and then keep that N95 mask until it's soiled, okay, and then throw it away. If you have a patient that's been coughing and all that crap, then just throw it away right in the beginning. But if it's something where you can reuse it, let's reuse it, but put your name on it, keep it in your boot, keep it in your gear locker, whatever you gotta do. All right, have a good day.